down, costs will go up, and essentially you will have with this board rationing of care. I have several of my colleagues. I'm going to stop. There are many more things we can talk about. We've got the next hour. I want to recognize my colleague, Dr. Hayworth from New York, for some comments.
Would the gentleman yield?
Yes, I'll yield.
Thank you, sir. Mr. Speaker, I send to the desk a privileged report from the Committee on Rules for filing under the rule.
Report to accompany House Resolution 287, resolution providing for consideration of the bill H.R. 2017, making appropriations for the Department of Homeland Security for the fiscal year ending September 30th, 2012, and for other purposes.
Referred to the House calendar and ordered printed.
I yield back.
The gentleman from Tennessee is recognized.
Thank the gentleman. Dr. Hayworth.
And I thank our distinguished colleague from Tennessee, Dr. Rowe. Dr. Rowe, in New York's District 19, I've been sharing a headline with our seniors and with all of our citizens, which is that the Affordable Care Act ends Medicare as we know it. It ends Medicare as our seniors know it, and you, sir, have stated the reason exactly. The Independent Payment Advisory Board, which was written into law, passed by the 111th Congress, signed into law by President Obama, the Independent Payment Advisory Board will assure that our seniors, starting in 2015, when they have to make a 0.5% cut in Medicare's budget, our seniors will stop having the access to care that they are accustomed to, and they will not be happy about it. And then in every successive year, in 2016 it will be 1%, 2017 1.25%, 2018 1.5%, if I've done that math right, Dr. Rowe. Our seniors will find that their access to the doctors they know, the doctors they prefer, will not be the same. So when we talk about what we need to do as a nation, we in the House majority have pledged to our seniors that we will keep the promises that America has made to them to make sure that Medicare benefits remain secure and safe for as long as they need them, which is why in the budget that we passed in April, the Path to Prosperity budget, we guaranteed that seniors 65 and above, and in fact our citizens age 55 and above, will not see changes to Medicare as they know it. That gives Americans 10 years at least to prepare for a more secure future for Medicare for exactly the reason that you've talked about, Dr. Rowe, which is that we have many blessings in this extraordinary country. And one of them is that we do continue to make wonderful advances in medical science. And they do come at a certain cost. So we have a challenge that we need to face together. There are certainly ways in which we can, together as a nation, figure out how we make our health care more cost effective. And there are lots of opportunities. It's true there's waste, fraud, and abuse in the system. That needs to be addressed. There are also ways that we can protect our health better in our youth that Americans haven't necessarily had to think about nearly as much in the past couple of decades, but that they are starting to think about. So we need to make sure that we're making those advances together and that our seniors and all Americans who need advanced care will be able to get it, that the sickest among us will not be deprived of care because of the arbitrary decisions of a board that has to cut budgets. Again, that's the headline. The Affordable Care Act ends Medicare as you know it, but what the budget that the House Republican majority passed in April does is to restore Medicare as our seniors know it and allow all Americans time to prepare for a better future for Medicare. Thank you so much, Dr. Rowe.
I thank the doctor for being here. Just for the viewers today, I want to thank all of my colleagues for being here, and all of you all are health professionals, not career politicians. I want to point out that Dr. Hayworth has just joined us in the Congress. I'm a one-term congressman. I practiced medicine for 31 years. I know you did for a long time. We have OBGYN doctors, ophthalmologists, family practice, cardiovascular surgeons, nurses, in the well tonight. These are not long-term politicians. These are practicing healthcare providers who've been out there. And I think the question I always ask myself when I look at legislation, having just left the examining room, is that how does this legislation affect the care that I can give my patient? And I think that's the one that we all worry about. We worried about it with insurance companies. All of us have fought with insurance companies about providing care. And I believe that at some point in time, we all do this, that care is going to be rationed. The question is, who's going to do it? Is it going to be a federal bureaucrat and a federal nameless, faceless panel here in Washington, D.C., or is that decision going to be made between a patient, a doctor, and their family? And I believe that's who should be making health care decisions in America. It should be made in the examining room in the doctor's office with consultation, not by some nameless bureaucrat up here in Washington, D.C. I thank you for being here, Dr. Hayworth, and I'll now yield to Dr. Gingrich, my good friend from Georgia, fellow OBGYN.
Mr. Speaker, I thank the gentleman for yielding, and I thank him for leading this hour on such an important discussion. Of course, I think all of my colleagues on the floor here tonight understand that Dr. Rowe has authored the repeal legislation of IPAB, this Independent Payment Advisory Board created under Obamacare. Dr. Rowe, Mr. Speaker, just said that the doctor-patient relationship, the provider-patient relationship, be that provider an advanced practice nurse, a psychologist, a physician, even the hospitals, of course, are huge providers of health care. And who should we be concerned with as members of Congress? Well, it's those 700,000 people that each of us represent all across this country, and that doctor-patient, provider-patient relationship that is most important. Cost, of course, is important, but first and foremost is the sanctity of that care. And that's exactly what Dr. Rowe is speaking of, Mr. Speaker, and why it's so important that we do vote to pass his bill, and we do it as quickly as possible to repeal this very bad decision. In fact, Mr. Speaker, back I think in December of 2009, almost 2 years ago now, our colleague on the other side of the aisle, a senior member of the Appropriations Committee, the gentleman from Massachusetts, Richard Neal, authored a letter that many of us, in a bipartisan way, co-signed. I think over 100 signatories to that letter, literally begging the President and the administration to forget this idea of creating this exact same board that Dr. Rowe is talking about and my colleagues will be talking about tonight. It was called something different then in the construction phase of Obamacare. But whatever you call it, today, of course, we understand it is IPAD, Independent Patient Advisory Board. I call it IBAD. Independent, bureaucratic, absolute dictators. These unelected 15 people that can literally and will, as the gentlewoman from New York just said, Dr. Hayworth, that they will have the ability come 2014 to start making these cuts and to make them where the biggest growth area and cost is. Well, Mr. Speaker, we all know they say that there will be no rationing. Well, you can say it's not rationing, but if it walks like a duck and quacks like a duck and looks like a duck, it's a duck, and it is rationing. And what will happen, and we know it, we healthcare providers that have spent, 500 years of clinical experience in the aggregate, we know exactly what these bureaucrats will do. They'll say that if someone is above a certain age, let's pick one. Say if you're 65 years old and you come down with leukemia and lymphoma, and what you desperately need when that chemotherapy has failed to keep you in remission is a bone marrow transplant, but because that's so expensive that the decision will be made that nobody over a certain age will be eligible for a transplant of a kidney, of a lung, of a liver, of a heart indeed. And this is something that is absolutely unacceptable to us. It's unconscionable. So, Mr. President, and I say this through you, Mr. Speaker, please, listen to us. Listen to us. We've got another letter coming. It's going to be signed by all 21 of the members of the House GOP Doctors Caucus. I wish we had some Democratic members as a part of this group, but hope springs eternal, and maybe they will. But listen to us, because we know of what we speak. Don't make this mistake. Don't go down this road. This is not the way to solve the Medicare crisis and the insolvency that's coming very quickly by 2024. You say you can't accept the House, the so-called Ryan budget. Some significant, I think, very thoughtful, adult, mature decisions regarding what we need to do on Medicare. All right, let's get together and let's get in the room and let's talk about it. But you want to kick the can down the road and do nothing except slash Medicare to pay for your new signature issue, Obamacare, slash it by $500 billion. Don't put it back into Medicare, but create this whole new program, force more people onto Medicaid, weaken Medicare, and then just hope for the future. Well, I think American people have seen enough of that, and let me close by, I know there are a number of my colleagues here tonight that need time, but I thank the gentleman from Tennessee, and I will close with this. On the House GOP Doctors Caucus website, Mr. Speaker, and folks, my colleagues, you can go to that website, and your constituents can go to that website. It's doctorscaucus.gingrey.house.gov or doctorscaucus.murphy.house.gov. The reason for the Gingrey and the Murphy is that we just happen to be the co-chairs now of the House GOP Doctors Caucus. That obviously will change in future Congresses, but that's the way to go to the website, and we're going to ask you to sign a petition. Oppose the Democrats' Medicare cut board, because that's what it is, a cut board. Visit the GOP Doctors Caucus website, sign the online petition, oppose the Democrats' Medicare cut plan. And I yield back to my colleague.
I thank the gentleman for yielding, and I would like to point out to our viewing audience tonight that when the House version of this bill was discussed through 3 committees, when this was debated 2 years ago, this was not in the House version of the bill. This was not there. This Independent Payment Advisory Board did not exist. When this bill, the House passed through 3 committees, and then here as debated on the House floor, went to the Senate, that we knew that bill couldn't pass over there, so they brought one out that didn't go through a single committee hearing with this IPAB in it. And we have right here the letter that many, many members, bipartisan members, Dr. Fleming is here, Dr. Gingrey, myself, others signed this along with many people. Barney Frank signed this opposing this bill, Bob Filner, Dr. McDermott, Jim McGovern, on and on and on, that think this is a bad idea. And why do we think this is a bad idea? We believe that the people's representative, that would be us, if there's going to be a cut in Medicare, that some faceless, nameless board shouldn't have the right to do that, and that the Congress would abdicate its, I believe, constitutional right to control spending. So that's the reason that we're having this debate now. This should never have been in the health care bill. And just right here, before I yield to my friend from Louisiana, President Obama said on Medicare reform, now we believe the reforms we propose strengthen Medicare, and that would be taking $500 billion out. I have a hard time believing that's going to strengthen it when we've got 35 million more people going into it. Will enable us to keep these commitments to our citizens. And if we're wrong and Medicare costs rise faster than we expect, this approach, that's this IPAB, will give the independent commission, that's this 15 bunch of bureaucrats that are going to make $165,000 a year, I might add, the authority to make additional savings, and savings means we cut the money so you don't get care. Let me interpret this for you by further improving Medicare. You tell me how that improves Medicare if you cut services to people and they don't get needed care they need. I would now like to yield to my friend from Louisiana, Dr. John Fleming, family practice doctor.
Well, I thank the gentleman, my colleague and fellow classmate, Dr. Rowe from Tennessee. And what I thought I would do is take just a moment and to discuss the historical aspect of Medicare and how we got to where we are today. You know, I began medical school only 7 years after Medicare began. In fact, my colleague Dr. Rowe I think you're probably of similar age and station in life, and also Dr. Gingrey, who is here. Some of us may even remember before that. But I watched Medicare grow, and you know, the promise to physicians and patients at that time is government, if this is passed, will not mess with anything. It'll be all between doctors and patients. However, by the time we got to the 80s, we found that couldn't be true. The costs were exploding far beyond inflation, and so the government, Congress in fact, began to go through a number of calisthenics in order to make it work. One was RBRVS, which was a formula by which doctors would get paid rather than what their costs were. Then DRGs, diagnosis-related groups, to tell hospitals exactly what they're going to be paid regardless of their costs. Then CLIA. And then finally SGR, sustained growth rate, which we're struggling with now. And it basically means that if we miss budget targets, doctors get across-the-board cut, which would be up to 25–30% today. And of course Congress keeps kicking the can down the road because Congress knows that if we were to actually implement the cuts that are required by law, that physicians would stop taking Medicare patients and we'd have a serious, serious problem. So, if we fast forward to today, why is it that we can't control the cost of Medicare? And I just have to bring it down to the bottom line here. You control health care costs from one of two methods. One is a market-based, patient-centered method in which the patient is in the driver's seat, working in partnership with his or her health care provider, making the decisions, but also having a responsibility to control cost, which means they have skin in the game, which means through health savings accounts and things of that sort, they have an investment in controlling costs for them, and therefore they control costs for the rest of the system. Fraud, waste, and abuse is taken care of by the user, the consumer in that case, making this, in fact, the patient to be a savvy consumer. On the other hand, you've got to command and control, top to bottom, which is what Obamacare is. And the only way that you can control cost, Mr. Speaker, by doing that is to use a system like IPAB, this Independent Payment Advisory Board, 15 appointed officials who have absolutely no accountability to anyone. They're unelected and unknown for the most part. And if you have a problem with their decision, there's nobody to go to. No one is going to answer the phone. And so what does this relate to ultimately? Well, we get inkling of where we're going with this through funds going into this comparative effectiveness board where studies will be determined to see how effective various treatments are and for whom. And this comes down to what is already implemented in Great Britain, NICE, which stands for the National Institute of Clinical Excellence. For a lot of people, it's not so nice. So how does it work? It goes like this. There's a certain number of procedures, diagnostic or treatment-wise, and there's so much money that can be spent on those, and then there's the needs, the people who actually need these. And so a determination is made based on a graph, if you will, or a matrix, whether or not someone's value to society, value of their life, in fact, they actually have a numerical value each year for what one's life is worth. And they go to this matrix and they determine in Great Britain whether or not it's worth that investment for them. So that may mean hip replacement, it may mean renal dialysis, or it may mean that your cancer doesn't get treated. In fact, if you look at the statistics, the comparative statistics between survival rates of prostate and breast cancer, two of the main cancers we deal with in this country, against Canada, which also has socialized medicine, in Great Britain, there's absolutely no comparison. The death rates are much higher in those countries. So I would submit to you, Mr. Speaker, today that if we continue down the Obamacare road, the implementation of IPAB, which is controversial even among the left of the left and very concerning for everyone, I think this is sort of the last shoe to drop when it comes to the creating of a government-run, socialized health care system in which bureaucrats will be making decisions about your individual life rather than you and your physician. And so we very much want to repeal Obamacare, but even if for some reason we can't, or until we do that, we desperately want to get rid of this IPAB, which we view to be toxic for our health care system and our culture in general. So with that, I want to thank the gentleman for having this discussion tonight, and I look forward to many more, and I yield back to the gentleman from Tennessee.
I thank the gentleman for yielding. I'd now like to yield to the gentlelady. We're blessed to have not only physicians in our health caucus, but registered nurses with years of experience in health care. And I'd like to now yield to the gentlelady from North Carolina for her comments.
Thank you, Dr. Rowe. Thank you so much. My comments are coming to you as a nurse in health care. And, Mr. Speaker, I know you understand the situation that we're discussing tonight as well. You know, the situation at hand tonight, there's so many to choose from. You know, we are all vehemently against Obamacare, and we know that it must be taken down. We voted to repeal it, only to fall on the steps of the Senate with nothing forward. So we're taking it apart piece by piece. This Independent Payment Advisory Board, let's think about that for a moment. One of the points that my colleagues have made is that this is an independent board that's going to make decisions about your health care. The American people's health care, if they receive Medicare, a board somewhere in this country, I guess I would imagine here in Washington, will come together. Your situation, your diagnosis will be sent in, and they will convene and they will decide whether or not you're going to receive the procedure that's being put forward, or whether your physician will actually get paid for that procedure. So not only does this limit the health care that you might be able to receive, but it also dictates to physicians what they can and cannot do. Imagine a physician sitting down with a patient and discussing the possibility of a hip surgery after a broken hip, only to find out a day later that that surgery cannot be done because this independent board has decided that that patient's age is too progressed, or maybe the patient takes too many medications, or they just feel that this isn't going to be a positive outcome. Imagine that patient, imagine that family looking into that doctor's eyes and saying, "You cannot do my surgery? You cannot fix my hip? I was a normally functioning individual 2 days ago, and now I cannot have surgery?" This is what Obamacare has put in place. It's cut $500 billion out of Medicare, and it's going to put a panel in place to limit the amount that can be spread around. $500 billion. That is an incredible amount of money. You know, I just want to elaborate on my comments. The board itself is just unbelievable. But let's face it right now in America. Physicians are closing their doors. Physicians are dropping patients with Medicare because they simply cannot afford to do business any longer. All of these things that we're facing right now, we talked about the SGR. We talked about how physicians are being paid. There is so much uncertainty in the healthcare world directly because of Obamacare. Hospitals are scrambling to find out and figure out and crunch the numbers on how they're going to be able to continue to provide care throughout the years moving forward. We must follow through on this legislation because it is going to affect every American. It doesn't matter how old you are. This is just a start. This is just a foot in the door. A board like this is dangerous beyond all imagination, and I applaud you, Dr. Rowe, for all of your work that you have done, because this is the right step to take, and I thank you.
Before you leave, generally, I thank you for yielding back. Let me just point a couple of things out that concern me about this bill. And again, back to my premise that health care decisions should be made between patients and their doctor. You know, I've had patients in my practice who've been in their 70s or 80s who are much healthier than someone who may be 40 years of age. I've seen them. As a matter of fact, at home, one of our folks that helps cut wood and clean and take care of the Appalachian Trail, he does trail maintenance, is 92 years old. And he's out hiking on the trail, a very healthy gentleman. And we see this over and over. This Independent Payment Advisory Board, and I'm going to run down it real quick, just to let you know what authority this U.S. Congress right here, and I think this is a bipartisan agreement that we're doing away with. It's created under Obamacare, the Senate version, not from the House of Representatives, remember. It creates targets and requires Medicare to make those cuts when those targets are reached, not based on quality and access, but just a specific number. And it targets only senior benefits and, and providers. And here's the other little thing that's not known and we haven't even talked about tonight. This IPAB will start out for the first 5 years affecting the prescription drugs and physician providers. But at the 5-year mark, your hospital is also included in that. And that means that they can cut the costs, cut the payments to hospitals, and maybe many rural hospitals, we fear, where I live in a very rural area in America, may close because of this very provision right here. And it's targeted at high-growth areas. Seniors are shut out when IPAB selects Medicare cuts and barred. They can't, there's no one they can go to even complain about this. They can't go to their doctor, and they can't go to their congressman because the Congress gave up its ability to control those decisions. So that's one of my great frustrations is this Congress right here is giving up its constitutional authority, and we are beholden to the people who elect us to do what's right, not some nameless bureaucratic board. I'd now like to yield to the gentleman from Indiana, our new member here, Dr. Larry Bichon, who is a cardiovascular surgeon, brings a great expertise in cardiovascular surgery. Welcome to the floor tonight, Dr. Bichon.
Well, thank you, Dr. Rowe, for yielding. I was a cardiothoracic surgeon just recently, last year, prior to coming to Congress. I help patients and their families make informed decisions regarding the care they need or the care of their loved ones, what they needed. I provided a professional opinion based on the facts, and sometimes had to convey information and news to patients and their families that they didn't want to hear. Mr. Speaker, I came here to tell the American people the truth that sometimes can be difficult to hear. But the American people deserve the truth about what's happening with health care in this country. The majority of my patients were Medicare patients. We know that Medicare is one of the main drivers of our long-term systemic debt. I want to reiterate that on May 13th, the Medicare Board of Trustees released their annual report on the program's financial status. In it, the Medicare trustees stated that the Hospital Insurance Trust Fund will become insolvent in 2024. That's within 13 years, Mr. Speaker. 5 years sooner than last year was predicted. And from a physician standpoint, according to the American Medical Association, 1 in 3 primary care doctors is currently limiting Medicare patients in their practice, and 1 in 8 physicians is forced to refuse Medicare patients altogether due to the cuts already that have been made in the Medicare program. And with the Medicare population estimated to double by 2030 to approximately 70 million Americans, imagine the access problems we're going to have then. Today, the average couple that turns 65 is paid in over $100,000 to the Medicare program, but is receiving over $300,000 in benefits. Mr. Speaker, this is not a sustainable model. Without significant reforms, beneficiaries in the future are going to be at risk for limited access to quality care they deserve and they count on, and ultimately face rationing of care, waiting lists, and dramatic cuts to current seniors based only on the cost, not based on what Dr. Rowe has said, the quality of care or what type of care they need, but based on the money alone. Anyone promoting the status quo is dooming Medicare to failure, and soon. It's coming up in 2024. Our plan doesn't affect anyone, any American over age 55. They've counted on these benefits. But what it does is it preserves the program for future Americans. Again, the status quo is dooming Medicare to failure, and soon. Congressional Democrats and the current administration have offered no plan to date, except the Independent Payment Advisory Board that Dr. Rowe and others have been talking about in the Obamacare bill. 15, again, I want to say again, 15 unelected Washington, D.C. bureaucrats making decisions about Medicare, making decisions about the future of health care for our seniors. IPAB was thought to be maybe the silver bullet, if you listen to them tell the story, to control costs. But what IPAB really will do is we'll recommend cuts be made to the program, not savings, cuts we're talking about here. CMS will then make those recommendations to Congress unless we get a two-thirds vote. They go in play. They start to happen. We have given up, as Dr. Rowe said, our congressional authority to do something about the future of health care for our citizens. This is a misguided approach that will, again, empower this group of unaccountable bureaucrats to determine the type of health care you may receive based on your age and your health. Health care decisions are best made when left up to the patient and their doctor. You and your doctor and your family know what's best for you, not the government. And I want to finish by saying, for me, personally, Mr. Speaker, this is about the future of health care for the American people. I fear for what the future may hold. Access problems, waiting lists, rationing of care. Look at other countries that have socialized medicine. All of these things are occurring. This may be based on your age, based on your health. We don't know what they're going to be based on in the future. It could be based on other factors. Do we really want this type of health care for the American citizens? I would answer no on behalf of my patients and behalf of all Americans, and especially in the case of IPAB on behalf of our American seniors. And with that, I yield back, Dr. Rowe.
Well, Dr. Sean, let me throw this question at you a little bit. When you are seeing patients in your practice, and basically those health care decisions are made between you and them, when you look at their relevant clinical data and their symptoms, and you can see that there's a lesion, maybe a heart surgery that you can do to help them, and it's based on what their needs are. And I have never understood, since I've been in this Congress, why health care has ever been a partisan issue. Have you ever seen a Republican or a Democratic heart attack in your life?
Never.
No. And
They're Americans.
I've never operated on a Republican or Democratic cancer in my life, pelvic cancer. Why in the world? And so this is one where there is bipartisan support because both sides of the aisle understand this is a very bad idea to get on this slippery slope where you allow Washington bureaucrats, and they can be called experts if they want to be, but they're going to be making clinical decisions for people they never have placed an eye on or a stethoscope on their chest. And I, for one, am going to go down swinging on this because I believe this affects all the people in this country in a very, or potentially in a very negative way, including the President, because he will be under this same plan. And unfortunately, many people will probably try to opt out. We're already seeing all the opts out for the private health insurance plans, but I, as a 65-year-old, can't opt out. I'm in. I'm going to be part of this. And I know what my patients have wanted, and I just wondered if you've seen the same or feel the same way I do about that. And I yield to the gentleman.
I feel exactly the same way, Dr. Rowe. For me, again, I've never seen a Democrat or Republican patient. I see a patient. In fact, in my practice, as a heart surgeon, frequently I didn't even know what type of health care coverage that patients have. For a doctor like you or me, for any health care professional, what matters is what's the right type of health care to provide for that patient, regardless of ability to pay. And what we're looking at here is the potential where these bureaucrats may tell you, Dr. Rowe, that you cannot treat this patient based on their decision about whether or not it's affordable for the American people. They're going to make decisions based on money, not based on what needs to be done. And with that, I yield back.
The gentleman yield. What I believe will happen in that situation is that the federal government will have overpromised, and what we as physicians will do is provide that care and shift that cost somewhere else until there's nowhere else to shift it. Because I know how, if I see a patient that needs care and they are 75 years old, let's say, and they have needed surgery and I can improve the quality of their life with that, we're going to do it some kind of way. And you know you've done it. We just figure out later how to pay for it. That's not the way to do this. I thank the gentleman. I'd now like to yield to the gentleman, my colleague and good friend from Tennessee, Dr. Scott Desjardins, also a new member of Congress, and welcome to the House floor tonight.
Thank you, Dr. Rowe. I appreciate you leading this discussion. Thank you, Mr. Speaker. I rise tonight in support of my many physician and other healthcare colleagues that are in the chamber tonight to discuss what I agree should be a bipartisan issue. It's been so disturbing to me after being in Congress just 5 months to see some of the disrespect that goes on across the aisle and the floor back and forth. But when it comes to our seniors' health care and health care in general, it's something I take very personally. I think I can speak for all of my physician colleagues, nursing colleagues, our dental colleagues that are in the doctor's caucus, that none of us went to medical school or nursing school or dental school to become politicians. We went into those fields because we care about people. And we're now here for that exact same reason. And to sit in this chamber and listen to accusations about this plan of Paul Ryan's to help save Medicare is just more than I can stand to not get up and at least share my thoughts. Because the bottom line is, as some of my colleagues have mentioned tonight, the CBO states that the cost of doing nothing is that Medicare will be broke in 9 years. We've also heard that 10,000 new Medicare recipients are entering the pool each and every day. We also have talked about the fact that the average age of a Medicare recipient in 1965 in terms of life expectancy was 68. So at that time, you would expect it to be on Medicare, Dr. Rowe, for approximately 3 years. Well, thankfully, due to advances in medicine, men and women are both living on average at least 10 years longer. And I think Dr. Bashan mentioned that the average couple pays in about $100,000 per year or $109,000 into Medicare taxes, but are extracting $343,000. So it doesn't take a mathematician or a CBA to figure out that this program has been severely mismanaged. So when we step up as a conference and as conservatives to help save the Medicare program, but yet we watch one after another members from the other side of the aisle get up and use scare tactics on our seniors saying that this plan is cutting their Medicare. That's just simply untrue, and I think that we need to set the record straight, and people deserve to hear the truth as has been spoken here tonight. So I join you in my concerns that these are patients we're talking about, these are people, and seniors deserve to know the truth that if they are 55 and older, this plan does not affect their Medicare. I know that the message has been unclear because I conducted a teletown hall just last week before the Memorial Day weekend. And we had over 20,000 people call in, and the majority of the questions that we were asked was, why is my Medicare being cut? So I think that we need to reiterate the fact that if you're 55 and older, there are no changes. If you're under 54, we're taking steps to make sure that your Medicare will be preserved and saved and protected for future generations. Anything else would be simply irresponsible. Another claim that was disturbing to me was the special election in New York. Some claim that the reason that the conservative candidate lost was because of our attempt to save Medicare. And it was spun as that cutting Medicare is something you just don't touch politically. But I know a lot of us, including yourself, Dr. Rowe, didn't come here to play politics. We came here to do the right thing. And the right thing is to tell the American people the truth. And what we're trying to do is protect that plan. The plan that is going to cut Medicare, that has been mentioned already, is the Obamacare plan. And that seems to have been pushed to the back burner, and that's a dangerous thing. The IPAB bill that you sponsored, and I'm proud to co-sponsor, is a great example of that. So we need to speak boldly and let the people know the truth so our seniors are not afraid and scared by political tactics. So I'm proud to join you tonight in this discussion.
Would the gentleman yield?
Yes, sir.
Let's go back to what you were saying, Dr. Desjardins, just a moment ago. And we've discussed tonight this Independent Payment Advisory Board in some detail about what it does. We've also discussed, the Ryan plan has come up about what is in the future. Well, why are we having that discussion? Well, we're having that discussion because we see Medicare as it is being unfundable in 2024, 13 years from now, and that could be a moving target and change. So we want to sustain this. I think both sides want to sustain Medicare as it is. So we know that people are 55 and older. If you're 70 years old now, nothing changes for you. My mother is 88 years old, and nothing will change for her. But if you're 54, what happens to you? And why do we think that will work? Well, what happens to you at 54 is you're offered exactly the same health care plan that I have and you have right now. Maybe you have. I have Medicare Part A. I would like to still have the plan I had. But you'll have exactly the same plan that Dr. Desjardins has. And what plan is that? Well, basically what the premium support is that a person just looks at when you turn 65, you will look at your health care plan as the federal government's your employer. They pay that part of your premium and you pay some other. Now, a higher income senior like you or myself, we're going to get a bigger chunk of that. So it is going to be indexed based on what your income is. If you're 65 years of age and let's say you have multiple health problems and you're going to have a more expensive plan, you'll pay less than that. If you're a low-income senior, you will pay less than that. Why do we think that will work? We've heard all these things about insurance companies. Why do we think that will work? Well, the one single plan that has ever come in under budget that the federal government that I know of in health care is Medicare Part D. Now, whether you believe in donut holes or not donut holes, but in the 10-year budget estimate, Medicare Part D, which is the prescription drug plan, was estimated to cost about $630 or $40 billion over 10 years. It came in about $337 billion, a 41% decrease. So when patients have choices and people can go at it, it's not one shoe fits all, one size fits all. People have choices to be able to go out and pick out what kind of health care plan is best for them. For me, I like a health savings account. Someone else may pick another plan with a 20% copay. But those patients, those Medicare recipients at age 65 will be able to make that choice, not some nameless board deciding what kind of care you get. Now, I will say that we do need to help control the costs. That's why we're having this discussion. But again, I believe who should be making those decisions are patients and their families and their doctors. I want you to stick around for a minute because I've got some more questions, but right now I'd like to yield to Anne Marie Burkle, a great new member of our Health Caucus, a nurse and an attorney. I won't hold that against her, and she is from New York, and welcome to the meeting tonight.
And I thank you for this time, and Mr. Speaker, I rise here tonight along with my colleagues and other members of the Doctors Caucus with such concern about what is being proposed in the health care bill and what is now law. And I think we need to have a frank discussion with the seniors, Mr. Speaker, because of the demagoguing and the fear-mongering that has gone on by proponents of this health care bill. The fact is this health care bill, Mr. Speaker, is law. And if it goes on without being interfered with, Medicare as we know it will be decimated. $500 billion in cuts. That's going to affect the seniors. That's the law, and that's what's in place right now. What we are proposing on the Republican side is that it is a proposal, but it is a place to begin the discussion about how we are going to save Medicare. And we must say over and over again to our seniors, this bill will not affect you if you are 55 years and older. You will retain the exact same benefits that you have now. But we as health care providers, we as those who went into health care as advocates because we care about people, we want to protect and preserve Medicare. And that's what this proposal is that the Republicans put forth in a budget. I think, Mr. Speaker, the irony in all of this is those who pushed this health care bill, organizations who pushed it on seniors and said, this is a great bill and vote for this health care bill, they now have waivers from the health care bill. They now are saying, well, it's good for all of you folks, but it's not so good for us. That should raise red flags. And so I'm so pleased to be here tonight with my colleagues to be able to have this conversation with the seniors, Mr. Speaker. They need to know the truth. They need to know that we want to preserve Medicare. We want to make Medicare better for us, for our children and their children. And that's what this is about, and I yield back, and I thank you for this time.
Well, I thank gentlelady for yielding. And who more than anyone, the Health Caucus and the Physicians Caucus wouldn't want to maintain Medicare? And one of my frustrations that I've had in this body is, how can you solve a problem if you can't discuss it? And right now, we're not even able to discuss in a logical way how we reform Medicare. And those Medicare changes, we've only mentioned a few of them, I might add. There are many others in here In 2012, that will be just next year, there'll be Medicare cuts to dialysis treatment. Medicare cuts to dialysis treatment. Medicare cuts to hospice begin in 2012, and on and on. And it's one of the things, it's one thing to have a problem. It's quite another not to be able to even discuss the problem. So let's just summarize it briefly here, and then I'll yield to you that are still here. We had a problem in this country with health care costing too much and a group of people that couldn't have access to care in a liability crisis. We did nothing with this Obamacare bill to curb the costs. How we helped pay for the Affordable Care Act is we took money out of Medicare. And to control spiraling Medicare costs, we set up a board. This bill set up, not we, but this bill set up a board called the Independent Payment Advisory Board. Most people, including many physician friends of mine, don't have any idea what this is. It is a very bad idea. It's not a good idea in England where it's being used, and that's where the group that wrote this bill got it. And you know why they want this, why the people that signed this, the Senate and others? Because they don't have to be accountable. They can blame somebody else when needed care isn't given. Oh, it isn't my fault. This board did it. Well, it is our fault. If we give up that right, it's our fault if those cuts occur to our seniors and we cannot provide the care that they need. So why we're having this discussion is that we've got a budget problem. We have got a $1.6 billion budget deficit in this country we have to close. And how do we do that? We look forward and see where are the costs going forward. And as I mentioned, when the President of the United States is 65 years of age, 15 years from now, four things will take up every tax dollar that we take in. So it's mandatory that we begin now solving this problem. And I think the plan is a great plan, the Ryan plan. It allows people to plan. It also, I believe, will allow you more choices. And I believe that that's exactly what the American people want in health care, is not someone up here in Washington making those choices for us and our patients, but the patients and the doctors making those choices. And I'll yield to the gentleman, Dr. Desjardins, if you'd like to have some comment about that.
Well, I mean, you're correct, and I agree with everything you said. And the point that a lot of folks made on the campaign trail is there simply is too much government medicine. There's unsustainable cost. I know our colleague from New York, Ann, as a RN, probably recalls the day where she spent more time on patient care than documentation, and now most nurses will acknowledge that it's just the reverse. They spend much more time on paperwork and bureaucratic issues than taking care of patients. And I think that it's important that we remember that just a short time ago, when the Affordable Health Care Act, more commonly known as Obamacare, was being pushed forward, Americans vehemently opposed this bill. And I don't want them to forget all the reasons why they opposed it. They didn't ask for it, we can't afford it, and we don't need it. There were approximately 30 million uninsured people, according to the President at the time, but yet up to 75% of people rated their health care as good or excellent. So we're taking a system that has flaws and excessive costs and trying to completely turn it upside down with this Affordable Health Care Act, which we all know is going to lead to rationing of care, decreased quality of care, and increased costs. You can't add people to a system and decrease costs without rationing care. So I think it's important that the people stay engaged and speak out and acknowledge that they want the relationship to be between themselves and their doctors and not between Washington bureaucrats, such as what the IPAB is proposing. That's exactly what we're going to see, and we need to stand firm. The American people don't need to forget why they were opposed to the Obamacare bill in the first place.
I thank the gentleman for yielding. I yield now to Congresswoman Burkle from New York for closing
Thank you very
comments.
much. I think it's so important to have this conversation with the seniors. We want to preserve your relationship with your physician. There's nothing more sacred than that relationship. This IPAB panel will disrupt that. It will become right between you and your physician. It's so important that we get the facts out, that we have this conversation with seniors, that you understand that we are fighting to preserve Medicare, fighting to preserve Medicare as we know it, and Medicare and the patient-physician relationship. So with that, I thank you for this opportunity, and I yield back my time.
I thank the gentlelady for yielding, and I will finish by saying that I know that the Health Caucus and the Physicians Caucus are totally committed to this bipartisan bill, this repeal of this IPAB. And again, just to summarize what it is 15 bureaucratically appointed people approved by the Senate, his administration. I don't want a Republican president or a Democrat president appointing these people. And that what they will do is make a decision based totally on cost. The Congress then it requires a 2/3 override to change, or they have to make the cuts. We have to make the cuts someplace else. CMS will be in charge of how those cuts are taken care of. I think that responsibility, that fiduciary responsibility, is right here in the elected body that meet with the people. I thank the gentleman for being here tonight. I thank the gentlelady for being here, and I yield back the balance of my time.
The gentleman's time has expired. The chair must remind all members that remarks in debate are properly addressed to the chair and not to the viewing audience. Under the Speaker's announced policy of January 5th, 2011, the gentleman from Rhode Island, Mr. Cicilline, is recognized for 60 minutes as the designee of the Minority Leader.
Thank you, Mr. Speaker. I would like to begin our remarks today, which will focus on our Make It in America agenda, the agenda that we've put together to put the American people back to work, to really support manufacturing, and we're going to have a good discussion tonight about that. But I'd like to yield first to the gentlelady from Alabama, who has some important remarks to share, and I yield to Ms. Sewell, Congresswoman Sewell.
Thank you so much for yielding. I rise today before you to discuss the recent disasters, natural disasters that have affected families, businesses, and communities across this nation. In the aftermath of such disasters, there must be a shared commitment to rebuilding communities across this nation. My thoughts and prayers are with the people of Joplin, Missouri, who suffered the most recent wrath of nature. We in the 7th Congressional District of Alabama suffered massive devastation during the April tornadoes. 9 out of 12 counties in my district suffered tremendous damage. These pictures only show part of the story. Homes were destroyed, schools, churches, businesses, and communities were destroyed, and many of my constituents lost the lives of their friends and loved ones. I want to thank the President and the First Lady for visiting my district and seeing the devastation firsthand. Mr. President, you told us then that you had not seen such devastation before. You also said that you would make sure that we were not forgotten. Thank you, Mr. President, for your commitment to rebuilding Alabama. I want to thank your administration for responding so quickly. Within hours, FEMA Administrator Craig Fugate was on the scene to survey the widespread damage. The Emergency Disaster Declaration and the Major Disaster Declaration were approved within hours. I also want to thank Homeland Security Secretary Janet Napolitano, HUD Secretary Sean Donovan, Agriculture Secretary Tom Vilsack, and SBA Administrator Karen Mills for traveling to my district days later. As a result of the April tornadoes, 67 lives were lost in my district alone. And in the state of Alabama, 238 people lost their lives. I want to extend my deepest condolences to those who have lost their loved ones. I want to thank all of the first responders who were on the scene to help so many of the victims. I also want to thank the volunteers who continue to work tirelessly to restore the lives of families who lost all that they had. The destruction and loss of lives has been absolutely heartbreaking. But out of this tragedy, we will triumph. We will recover, rebuild, and restore our communities. We will be better and stronger than before. I am inspired every day by the resilience that my district and the state of Alabama and the people have shown. Neighbor helping neighbor. The response by the state and local government has been tremendous. I want to thank Governor Bentley of Alabama for his leadership and timely response. The coordinated efforts of my local mayors has been amazing. I'd like to thank Mayor William Bell of Birmingham, Mayor Walt Maddox of Tuscaloosa, Mayor Cunningham of Geiger. Your leadership and tireless efforts have been commendable. I also would like to commend the Alabama Emergency Management Agency under the leadership of Art Faulkner. I would be remiss if I did not mention the incredible support and help of my colleagues within the Alabama delegation. What we have learned is that what affects one of us indeed affects all of us. Together, I know we will work to rebuild Alabama. I yield back the remainder of my time. Thank you.
I thank the gentlelady, and I know we all stand in strong support of the work that is underway in your district and all across this country, and our hearts and prayers continue to go to the families who have suffered such tragic losses during those terrible incidents. And we compliment the first responders and the mayors and all those you've recognized tonight. I'd like now, Mr. Speaker, to turn to the agenda that we announced several weeks ago that involves really a comprehensive set of pieces of legislation to really support American manufacturing. Our country has a proud tradition of making things. We built the world's strongest middle class because, in large part, so much of what the world needed we made here in America. And for millions of Americans, our tradition of making things here has been a source of opportunity and great pride. And today, with millions of Americans still out of work, and with an economy which is still struggling, it's time to draw from that tradition to build a positive, job-creating agenda. The American dream used to mean something, that if you put in a hard day's work, you could expect good American wages, benefits, and a better life for your family. It meant that when products said "Made in America," people knew that they were getting the highest quality manufactured goods money could buy. It's time working Americans used our strength in numbers to reclaim the American dream. Working people deserve a voice at the table, and if we lose that voice, we'll lose what our grandparents fought so hard to leave us. And we should start with manufacturing. The number of Americans involved in producing goods is still near its lowest point since World War II. But manufacturing is central to our economy. The National Association of Manufacturers tells us that manufacturing stimulates more economic activity than any other sector. It's time we started expanding opportunity and stopped shrinking the middle class. And so this effort to really understand that we have to start making things again, that manufacturing matters. And I want to yield in a moment to my friend, Mr. Garamendi, certainly our leader in this Make It in America agenda, and someone who has spoken so passionately and so forcefully about our ability again to lead the world in making goods so that we can start shipping goods that are made in this country all over the world. Instead of exporting jobs, let's export American-made goods. I tell my constituents, and I hear from them all the time, go into a store and try to find something made in America. It's almost impossible. And it doesn't have to be that way. We still have the best workers in the world. We still make the best products in the world. And what we need are good public policies that support American manufacturing, that support job growth in American manufacturing, that give fair trade and tax policies, that give American manufacturers a fighting chance to compete in the global economy, and efforts to be sure that our trading partners, like the Chinese, stop cheating and play by the rules and are held accountable when they do. And so we put together an ambitious agenda to really make things again in this country, because when we make things in America, families can make it in America. And we have a series of bills which we're going to talk about tonight, but I want to yield to the gentleman from California who has been such a passionate voice on the importance of rebuilding and strengthening manufacturing in this country. And if you think about, think of those days when you'd go into a store and you'd pick up an item and it'd say, "Made in the USA," and the kind of pride we felt because we knew that was a product that was made well, built well, that would stand the test of time, and we could sell it all over the world. We can do that again. We are doing it. We have some great manufacturing in this country. We're seeing a real growth, particularly in new manufacturing, high-tech manufacturing, which requires innovation and entrepreneurship and the kind of investments in technology that will help us lead the world in this new knowledge-based economy. And so this effort is to really understand this is part of our history, it's part of the present day, and it's part of our future as a great economic power. And with that, I yield.
Mr. Cicilline, it does not surprise me at all that you have a passion for this issue. You come from a part of the United States that really started the Industrial Revolution, the Northeast. In your state in particular, the Industrial Revolution started there. And over the years, it gave great strength to this nation, and it was the manufacturing that provided the economic underpinnings for the growth of the American economy. Unfortunately, your part of the state, perhaps for a variety of reasons, some of them having to do with national policies, began to lose its industrial base. But with your representation and your passion for this issue, I have absolutely no doubt that once again the Northeast will find the resiliency and the right national policies to rebuild the manufacturing base there and across the rest of the nation. We're already beginning to see it as a result of the stimulus program and some of the specific laws that were built into that program are now rebuilding the manufacturing base in the Midwest. Specifically, a requirement that for the high-speed rail systems and the rebuilding of the American inner-city rail programs, those goods, trains, rails, electronic systems, control systems, have to be built in America. And guess what? International companies are establishing, reestablishing, and building manufacturing facilities in America to take advantage of that money that was in the stimulus bill. Simple little things, not an increase, but rather using our federal money wisely. We can do it. We must do it. We will make it in America once again, and it'll be the great American manufacturing sector. And when we do this, America will make it. A lot of discussion here on the floor today about deficits. What are we going to do about the deficits? Are we going to raise the debt limit? Of course we're going to raise the debt limit. We have to. America stands behind its debts. We will pay. It'll engender a debate. Fine. Let's make this part of the debate. Let's make this part of the debate. In dealing with America's deficit, are we willing to put in place the policies that will rebuild the American manufacturing sector? And I know it is the Democratic agenda to do just that, that we will rebuild the American manufacturing sector, and in doing so, we'll rebuild the American economy and provide one of the critical bricks in solving the deficit problem. Without a growing economy, without a strong middle class, the deficit will never be solved. So we're out to do it. How can we do it? Well, how about our legislative agenda? Why don't you start us off on a couple of the bills and see where it takes us?
I thank the gentleman. I think one of the important